Hi, thanks for coming in today.
Thank you for seeing me.
My name is student Dr. Grisham.
Okay.
I'm working with your physician today.
Okay.
And if it's all right, I'd like to ask you a couple questions about what's been going on lately.
Okay. That's great.
So I noticed that you were feeling a pelvic mass.
Yeah, like a bump, like this hard thing when I push down.
Okay.
And it's kind of like starting to really bother me.
Okay, when did you first notice it?
Probably like 6 weeks ago, but I didn't think anything about it. And then I started getting like some other symptoms, and my friend told me I should call my doctor.
Okay, well, I'm glad you came in today. Do you feel like it's grown in the past 6 weeks?
Maybe, I think so. But even like more so, I just don't feel good. I feel kind of like tired. I'm having trouble buttoning my pants, so I must have gained weight.
Okay.
And then I just feel like gas, like I'm having trouble passing gas and having a bowel movement.
Yeah, definitely. Thank you for sharing those things with us. This bump that you've been feeling, where is it located? I see you pointing to kind of your left side.
Yeah, left kind of down low here.
Okay.
So I thought maybe it was just, a stool stuck in my colon or something.
Yeah. Have you tried anything to make the pain better?
Like Tylenol and Motrin.
Okay.
Yeah.
And have you used any type of laxatives to help with your constipation at all?
No, it's more like diarrhea. It's like it's loose and then it's not very big in like size or something.
Okay. Yeah, that makes sense.
Okay.
Any other symptoms that you're experiencing?
Just kind of tired and, I'm sleeping good and, I guess I'm just not very hungry.
Okay, so you kind of had some changes in your appetite.
Yeah.
What would you say? You say you're eating less?
I'm eating less because kind of my stomach hurts and I don't feel good. And then I don't know why I gained weight because like my pants are like I can't hardly, button them.
Yeah. So kind of interesting because you feel like you haven't been eating much, but you feel like you've been gaining weight when you're like trying to put on your clothes.
Yeah, exactly.
Okay. Have you had any like shortness of breath, nausea, vomiting?
Just some nausea, but nothing else.
Okay. What about any headaches at all?
No headaches.
Okay. Anything else that you want to share about this bump that you've been feeling?
I don't know. I just, I'm kind of concerned and nervous. I've never been, and I've never had any kids, and I guess I never breastfed then. So I just am like kind of worried because I'm all by myself. I mean, my sister kind of helps watch over me, but I'm just, concerned about what you're going to tell me today.
That makes sense, and being nervous whenever you come to the doctor is understandable. We won't be able to give you some specific answers today, but we will kind of start down the path to getting you answers.
Okay, thank you so much.
No problem. You mentioned that you haven't had kids, so you haven't breastfed. When did you start your period?
I think like 10.
Okay.
10.
And are your periods, do they occur monthly?
Yeah, every month. And then, I was never really sexually active, so I never took birth control or anything. Okay. So they were just normal. Okay,
that was going to be my next question is whether or not you've had birth control. So good to know that you've never had birth control.
Okay.
And are you currently sexually active?
No, I'm not.
Okay, thanks for sharing that. Any family history of any cancers by chance?
I think my dad had cancer. They thought it maybe started in his colon.
Okay.
And then my mother was my aunt on my mom's side. She had breast cancer.
Okay.
But my mom didn't.
Okay. Have you received your mammograms?
Yeah, I'm up to date on those.
Okay, perfect. Any abnormal findings?
No. They've always been okay.
Awesome. What about any history of abnormal pap smears?
Nope. None at all.
Great. And any history of sexually transmitted infections?
No.
Perfect. We always make sure we ask those questions of everyone.
Okay.
What about tobacco or alcohol use?
No, none of those.
Okay. And any other illicit drug use at all?
No, not at all.
Okay. And what do you do for work?
I'm a cashier, and I work at the local grocery store.
Awesome. So just to kind of summarize, you've been feeling this pelvic, like this bump, kind of in your left lower quadrant area.
Yeah.
Okay, right about your groin.
Yeah.
It's been giving you a couple issues. Specifically, you haven't really been able to pass gas, or you have these small bouts of diarrhea.
Okay.
You've been eating less, but you feel like you've gained some weight.
Yeah, exactly.
Okay, I think I can develop a good differential based on the information you gave me. Our next steps will be to get some tests and some further imaging so that way we can evaluate more.
Okay, thank you so much.
Thank you.